Hello, I am Dr. Nandan Yardi in Pune, and I am trained epileptologist, and I have been trained in difficult to treat epilepsies and pre-surgical evaluation of epilepsies. We run an epilepsy surgery program and we have operated large number of patients with very good results. Also, we diagnose different types of epilepsies, classify them properly and give appropriate treatment that gives best results in epilepsy. Epilepsy is a disease of the brain in which one gets recurrent fits or seizures. A seizure is a disturbance of brain electrical activity in which there is excessive excitation of the neurons. When a large number of neurons start getting excitable, then what happens is that it causes dysfunction in the brain. Now this may lead to loss of consciousness for a short while or longer. Motor activity in which one starts jerking, makes tonic movements of the limbs and maybe also starts jerking the limbs. Now this tonic-clonic jerkings along with loss of consciousness is what popularly is known as a clinical seizure or a fit. Many people have seen people falling down on the roadside, tonically and clonically jerking, which lasts for maybe a few minutes. Most seizures are self-limited and therefore do not require much treatment. What one needs to do is not to crowd around the patient, loosen any clothes, tight clothes that the patient is wearing, allow air to come and flow around the patient so he can breathe normally. It's good to turn him on one side, especially turn his neck on one side so he does not vomit, or if he's frothing, the froth does not go into the respiratory tract and choke him. This is all that needs to be done. If one can try to support the face so that there is no injury to the face. Jerking of the limbs usually may occur but will not lead to major injury. Most fits stop on their own. Nothing much needs to be done unless the fits last more than 4 or 5 minutes, in which case the patient should be rushed to the nearest hospital or a doctor should be summoned. Now what causes epilepsy? There are many causes of epilepsy. Usually, if we begin as the child is growing in the mother's womb, if there is an abnormal development of the brain, then this can lead to epilepsy sometime later in life. The birth process may be difficult in some other children who are born, and during this time there may be lack of oxygen, and this lack of oxygen causes baby not to cry immediately after birth, and that leads to damage to the brain. This can cause fits either immediately after birth or later on. Once in a while, children get infections of the brain such as meningitis or encephalitis, which may lead to high fevers, coma and then fits. And they can go on to have fits later on in their life. Once in a while, we see patients who have injury to the head. Now, wearing helmets is very important. If one has a road traffic accident, falls from a scooter or a two-wheeler, one can injure the head, and of course the brain inside can have injury and bleeding. This can lead to seizures right at that time or a few days later or many years later. So this is a very easily preventable cause of epilepsy. Therefore, everybody should wear helmets. Once in a while, what can happen is that somebody gets a tumor in the brain, develops a tumor in the brain, and this tumor gives rise to fits and maybe some other signs and symptoms. So there are many causes of epilepsy, and we need to find out what is the exact cause why a patient is getting fits. There are a few, of course, that are hereditary. About 20% of epilepsies have a positive family history of somebody in the family having fits or seizures. So these are the various causes. Often people have mistaken epilepsy for God's wrath or some kind of a curse, and so there are a lot of false beliefs. This leads to isolation and ostracism of the patient with epilepsy. There is no reason for this and there is no need to do this. Our society should understand that this is a disorder of the brain and that it is easily treatable and that patient should come forward for treatment. But how common is epilepsy? It's approximately seen in about 1 in 200 people. That's about 0.5 to 1%. And this is approximately the same figure all over the world. In developing countries, infections and infestations with parasites being more common, one may see a slightly higher frequency. One of the important causes in developing countries is that tapeworms, because of bad hygiene and consumption of vegetables, because of open field defecation, the vegetables may be contaminated, and then when one eats these vegetables, one gets tapeworm in the stomach, and what happens is some of the larvae of this tapeworm can migrate to the brain and lead to small cysts in the brain, which is known as neurocysticercosis. So this is one of the important causes why epilepsy frequency may be slightly higher in some developing countries. Now, what tests are required for diagnosing epilepsy? One is the history of how the fits occur, what happens first, whether there is a twitching of the mouth or some feeling, abnormal feeling of tingling or numbness in the hand or jerking of the limbs. This is very important, and the observer should see this. There are two broad types of epilepsy. One is a focal epilepsy, which begins from a circumscribed area of the brain and causes excitation of the neurons in that region, and whatever is the function of that part of the brain gets disrupted. So one may have tingling and numbness or some pins and needles sensation coming on the part of the hand, on the right hand, if the left brain motor area is affected. And then sometimes it moves its way upwards, and the patient can describe as the excitation in the brain moves from one part to another. Now, as the person describes this, one can know from what area of the brain it's coming. Usually the patient is conscious and can tell you. So these are called focal fits. Once in a while, a patient's focal fits can initially get a symptom such as a rising sensation in the stomach, that kind of fear, and then after some time he loses consciousness as the fit spreads in the rest of the brain, and then it's only the onlookers who can tell us what happens. Usually they start moving their face on one side and twitching one hand. So these are all focal fits where only one side of the body or one part of the body has disruption of functions. The other major group is the group of generalized epilepsies, which begin from the entire brain at the same time. And obviously, because it begins from the entire brain, what happens is the person loses consciousness, maybe for a few seconds, in which we say that this person has got absence attack. It means he is absent from his surroundings for a brief while. As I am speaking to you, if I just break and become blank, this is like an absence attack. But sometimes it is more prolonged, and the person may fall to the ground, he may have jerking and stiffening of the limbs, and this stiffening jerking can continue for a while. He may have frothing from his mouth, he may bite his tongue. What people should not do is try to insert something into the mouth if the tongue is not already bitten. Usually in many countries they either use a spoon or a hard object to put in the mouth and try to open that clenching. This causes more damage than would be caused by the fit. So these are the two broad categories of fits. The test that we do to diagnose epilepsy is known as an electroencephalogram or EEG. And EEG is a test in which small electrodes are put on the surface of the scalp, and a test is run for about 15 minutes or 30 minutes or 1 hour, in which the electrical activity in the brain is recorded by a machine. And this tells us what area of the brain is sparking excessively and what are the abnormalities there, and based on that we find out what type of epilepsy it is. So there are about 20 or 25 different types of epilepsies that manifest in different ways, which run different natural courses and therefore have a different outcome and different treatment. Not all medications for epilepsy are useful in different types of epilepsy, so one has to choose. Sometimes we do imaging of the brain to know how the brain structure is and whether there is some abnormality in the structure of the brain, for which we do usually magnetic resonance imaging, that is known as an MRI. And a high-end MRI will usually show the smallest of the defects. Then there are some special tests which may be done in specialized centers like ours, which I can't enlist in this video, but we sometimes do a SPECT scan, we do a PET scan, we do a functional MRI, we do some neuropsychological testing, and all these are required if you want to know different parts of the brain that are affected, that are leading to the seizure. And if you can find the origin of the seizure coming from a single focus, sometimes we can offer surgery to these patients, and often this surgery is then curative. But more or less, 85% of the patients require medical treatment, that is simple medication taken once or twice a day for at least a period of 2 years, sometimes 3 years, or sometimes 5 years, depending on the type of epilepsy that we are dealing with. These medications have to be taken regularly at the correct time and should not be missed for them to be fully effective. And there are about 12 or 15 different types of medications now available because of modern research into epilepsy. As we understand the mechanisms of epilepsy, the receptors where these medications act, and how the brain is getting excessively stimulated or excessively depressed at times, because of this imbalance of chemical imbalance or a neurotransmitter imbalance of excessive excitation versus reduced inhibition, both of which lead to excessive neuronal discharge. These medications are now available for use, and sometimes some of them are even better than the older medications. The older medications were effective, but sometimes not very well tolerated, and they had their side effects. Some of the newer medicines are equally effective and are much better tolerated and can be given for longer periods without major side effects. So, in general, epilepsy is a disease that can be easily controlled with proper medication and proper treatment. We need the correct diagnosis, correct classification, and then either it's 85% of the patients will be well controlled on medication that they may have to take for 2 or 3 or 4 years, and then the medication should then be gradually tapered down with the instructions from the doctor, and one can even stop the medications. Many patients, 60 to 70%, may be completely controlled or cured and go off medication. There are others who might have recurrence of seizures after stopping medication and requires few more years of treatment. As I talked about, some patients who have a single focus which can be demonstrated by pre-surgical evaluation, and if they have a single focus which is not in an important area of the brain, this can be removed by operation. This operation may last for about 3 or 4 or 5 hours. It's a major surgery, but then it can cause the epilepsy to disappear, and it can make a drastic change in the lives of the patients. Of course, the patients who have epilepsy surgery successfully are usually required to take the anti-epileptic medication also for a few years. However, instead of taking 3 and 4 medications giving rise to more side effects that they were taking before, they may need to take only 1 or 2 medications, that too on a smaller dosage with much reduced side effects and with much better outcome. So the message is for patients and for people out there who have relatives who have patients of epilepsy, you should come forward for treatment. Our major problem is that there is an 80 or 90% treatment gap in the whole world, including the developed countries, where patients try to hide their epilepsy. They want to hide their epilepsy. They feel that the person will not get married. There are social issues. The person hides the epilepsy because they feel that they cannot get employment. There are teachers who will ask the parents to remove the child from school till the epilepsy is treated and then only send them back to school. There are other people who feel that epilepsy is infectious, so they can't sit with the person with epilepsy. All this is all myth. It can be treated very easily, and one should come forward for treatment and get the appropriate treatment and feel better. People with epilepsy can lead normal lives, and it's the society's responsibility to involve them in our society for gainful employment and for a positive input to the society.